Hi, I'm Dr. Rebecca Bockow at Inspired Orthodontics. This is a quote from a dear friend and mentor of mine that I wanted to share. As orthodontists, we are the first professionals to make decisions that affect how a child looks for the rest of their lives. And so the choices we make with our clinical treatment plans have a tremendous impact on growth, stability, and aesthetics. So let's take a look at a case together. So this young woman came to see us and we were a second opinion. And we can see here that she's congenitally missing an upper right lateral incisor and her upper left lateral incisor is small. And so we see here the narrow upper arch, some crowding on the lower arch, and we have some decisions to make. So we think about quick treatment planning versus comprehensive treatment planning. So the first plan was to simply close the space on the right, to take out the tooth on the left, and to close the space on the left. This would definitely be an efficient treatment plan. So we look here at the upper arch, and we see that the upper arch is quite tapered. And so here are our two plans. We could move everything forward and close the space, or we could do something that would take more time, but would give us a broader, wider smile. And so after going through the two options with the family, we decided to distalize or to move the upper segments back, to expand the upper arch, and to create space for ultimately replacing the missing tooth on the upper right and making the smaller tooth larger with some dental bonding. And here she is after the expansion has been completed. We have completed this plan with some elastics, an expander, and ultimately with clear aligners. And what I want to really stress is the beautiful upper arch, how the upper teeth fit nicely with the lower teeth. And so we're really thinking about long-term form, function, and stability. And so this is the X-ray. And then looking at these side by side, this is really thinking about how will this young girl look as she continues to age and 20, 30, 40 years old. And so we see this upper arch form that's very broad, and we see that the wide upper arch really supports the soft tissue. So thinking about smile aesthetics over time. Thank you so much for your kind attention. Once again, my name is Dr. Rebecca Bockow, and please come see us at Inspired Orthodontics, inspiredortho.com. You can also follow us on social media at Inspired Ortho. Thank you so much.